Dental malpractice lawsuit cases in Saudi Arabia, a national study by Saed et al. In 2022. The dental practice in Saudi Arabia has evolved significantly over the past 20 years, along with the development of healthcare facilities, implementation of new technologies, and increase in the education and experience of the health practitioners, along with the increase of the patients knowing their rights. So, the litigation in Saudi Arabia related to the medical errors are administered by the Ministry of Health through 27 medical legal committees distributed across Saudi Arabia provinces. In the literature of Saudi health malpractice, there is a lack of the research on the dental litigation that cover all the provinces of Saudi Arabia. So the aim of the study was to assess the prevalence and the content of legal suits regarding dental malpractice in Saudi Arabia and to explore the factors and circumstances that were associated with these cases. For the methodology, it was a retrospective studies on a closed cases sentences by the MLC at the Ministry of Health, especially on the dental malpractice litigation cases that had a core verdict from January 2017 to 2020. The inclusion criteria of these cases were the cases based on Saudi Arabia, cases listed under dental category and that were reviewed by a dental committee, cases that have ended with a verdict between January 2017 to December 2020, cases that include complete details of the complaint and the trial. And the exclusion criteria were the missing data, duplicated verdict, anything other than the mentioned in the inclusion criteria. So the data collection from was created and tested as a pilot sample of 15 randomly selected cases to measure for validity and reliability. The form was categorized into three main sectors: the plaintiff demographic data and the defendant demographic data, and also the case details in the court. And the data entry was done using coding system for each case to maintain the confidentiality. For the result, the study included 864 cases, almost with two-thirds of the cases that were in 2019 and 2020, and the majority, with 75.5%, was against dental practitioners only, while 22.7 were against both the dental practitioner and the institution, and two-thirds of the cases were against male practitioners, while 93% of the practitioners were graduated from a non-Saudi dental school. The average amount of financial penalty paid by the defendant to the government was around 8,907 rials and 34,375 by the institution. And around 29.2% of the cases were in Riyadh, followed by Jeddah with a 14.9% and 9.4% in Asir. However, the cases in Dammam, Al Hassa, and Najran city were 8.2% and 7.8% and 7.1% respectively. Also, two-thirds of the cases were related to prosthodontics, followed by endodontics with 58.9% of the cases, and 40% almost related to the orthodontics, while only 25.8% the defendant was not guilty. As a conclusion for this paper, based on the findings, the number of the dental malpractice lawsuit cases is rising since 2017, and most cases are recorded against general practitioners and non-Saudi dentists. Riyadh and Jeddah have the highest number of malpractice lawsuit cases, and good documentation, compliance to informed consent protocol, and dental privileges help practitioner to avoid being found guilty. Prosthodontics and endodontic procedure were most associated specialties in malpractice lawsuit cases, and the average duration for trial period is responsible, and it's usually less than 6 months.